One of the primary reasons for overpronation is weakness of that tibialis posterior. So without that tibialis posterior, during loading response, you're going to see overpronation because that eccentric activity of that tib post to support that pronation will be diminished. We're also going to see problems with push-off because during that pre-swing period, that tibialis posterior cannot supinate the foot to allow for that rigid foot for push-off. It could be a structural problem, such as pes planus or a rear foot valgus. Then we're going to have overpronation throughout the gait cycle. It could also be coming from up the chain. So if we have poor performance of those hip external rotators, or we have anteversion, a structural deformity of the hip joint, that medial femoral rotation can cause that pronation to be exacerbated because as it rotates the tibia internally, that's attached to that talus. As that tibia rotates internally, it drives that talus into pronation. Pronation can be a compensation for rear foot varus, so subtalar joint pronates to get the medial aspect of the foot down. It can also be a compensation for forefoot varus, where that subtalar pronation brings that, again, that medial aspect of that foot down. So what are the effects of overpronation? Decreased push-off, because we have a flexible foot, therefore the force that we generate in that gastroc soleus can't be put into the ground efficiently. Plantar fasciitis, as we have that plantar fascia chronically stretched in a pronated foot and stretched under load, that's going to cause irritation to that plantar fascia. It can cause pain up the chain because pronation is associated with knee valgus and internal rotation. So we could see some patellar tracking issues at the knee joint. And all these malalignments can put a lot of stress on that great toe, which can lead to hallux valgus.